Hello and welcome to the Patient Educators Update. I'm Chuck Jones with Synergy Broadcast, and as always I'm joined by our expert guest, Fran London. Hi, Fran.
Hi, Chuck.
For those of you who don't know, Fran is the Patient Education Specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book No Time to Teach, which is the essence of patient and family education in a healthcare environment. Is that right? Did I get that right?
Close enough.
Yeah, okay. Now, this is a great book, and it was also recognized by the American Journal of Nursing as the 2010 Book of the Year, right?
Yes.
And it is the source of a lot of the things that we talk about today, and I'll hold it up, and we'll provide more information later on how you can get a hold of Fran's book. But we pull a lot of topics out of the book, but today, Fran, we're going to pull our topic from two different sources. One is from a conversation I had with a director of education at a hospital last week, and also an article that you found in USA Today recently. And I was having a conversation with director of nursing education and patient education, and she was real upfront with kind of what she was trying to do. She said our hospital has identified two key metrics or objectives that we're going to focus on, and only this. And she said the first one is to reduce length of stay, and the second was to reduce readmissions. And I had not heard a patient educator talk in those terms. Usually it's in other kind of more touchy-feely terms, but she was straight up front. She said, this is what we're trying to do. And she said, there's just no way we're going to do this without stepping up our patient education. We have to. And of course, you know, that makes total sense to me, because if you think about it, you can probably reduce the length of stay with some medications and a few things, but if you don't prepare the patient for life after the hospital, they're going to come back. So why don't you talk to us a little bit about how you see these two objectives? Do you see them being you know, kind of symmetrical in that they are both achievable, but, you know, how can you achieve them?
Well, they both absolutely relate to patient education, because part of a longer stay is that the patient is not ready to go home. Mm-hmm. And the readiness involves both physical readiness, but also the emotional and preparedness for self-care at home.
Yeah, I think you've called it the confidence to be able to take care of yourself.
Yeah, yeah, and if they're not confident, they're not going to be ready to go, and you shouldn't let them go because they'll be back.
Yeah, 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 and of course, a big part of being able to take care of yourself is understanding why you're in the hospital, what caused it, and what you can do to prevent future reoccurrences.
Yeah, and recognizing a problem early so that you can get the intervention that's outside of the hospital and not have to come back in. So there's a lot to it.
Yeah, and there's a financial impact here too. You know, I took a look at some of the data a couple of weeks ago, and we actually put together a little video. But we were looking at some of the numbers and research out there. The amount of money spent on readmissions is alarming. It's over $17 billion. That's over half of what Medicare is spending right now. So there's a significant financial carrot, if you will, for the average hospital to do whatever they can to reduce readmissions as Medicare and perhaps potentially just regular insurance providers begin to put the clamps on just, you know, fees for service as opposed to fees for results. So talk to us a little bit about what hospitals should be doing.
Well, you want to do a good job the first time. And that involves, well, I've said it before, throughout hospitalization, talking to the patient about going home, about what's going on, about what you're doing, so that by the time they can go home, they are ready. And you want them to feel confident that they can do what they need to do in order to take care of themselves. They need to understand the medications, the treatments, who to call, who to follow up with, and especially when you have lots of providers involved, making sure they know which one to call for which problem, because that'll be the most efficient way to deal with it.
Mm-hmm.
And then to recognize problems early on and know, who to call, whether it's something you need to go to the emergency room right away for, or if it's something that you can deal with at home.
Yeah. Well, now you tweeted or shared an article that you found in was it USA Today?
It was USA Today, the weekend edition, and it was talking about how to avoid getting readmitted to the hospital. And it was basically an interview with the CEO of Robert Wood Johnson Foundation.
Mm-hmm.
And they talked about the same things we talk about because it is evidence-based and everybody knows that these things work. Things like using teach-back, that if the patient can repeat back to the provider what the instructions are, what they need to do, that gives them confidence that they really do understand and that they are ready. Making sure you understand your medications so that you know what the side effects might be and can recognize them early on and intervene, or know whether or not they're working and to call somebody if they're not. So it's the same principles that they talked about in this article because everybody needs to know what they are.
Yeah, and I think we've said this before. It's good to see more and more attention being paid to this. Because I think you also pointed this out in another episode that the medical community is always focused on evidence-based when they do anything except patient education. And there is in fact evidence that supports everything that you say, but they don't always pay attention to it.
Well, it might seem illogical.
Yeah.
That it might seem that it's easier to just lecture at somebody and expect them to change their behaviors automatically. But that's not how things work.
Yeah, and that was, as I recall, we talked about that being the old medical model, where you just tell the patient, here's what you go do, and expect them to go do it. But the patient today is not going to respond to that. They need to know whys and hows, and there's all kinds of things that go into there's beliefs, and why don't you expand on that just a little bit?
Well, there's also there's what you believe and what you want. Some people have a strong philosophy that they're against medications. So they need to be able to talk to their care providers and express that this is their concern and ask if there are things that are not medications that can be good treatments, lifestyle changes or diet changes that they can use that might help them defer or not have to take medications at all. So you have to have those conversations. That's what healthcare is.
Yeah, and as you so famously say, next to saving patient lives, the most important thing nurses and nurse educators do is what?
Is patient education.
Patient education, exactly. And now we see that there is a significant relationship between the nurse's ability to effectively do that, meaning having the right tools and then having a process that they can easily follow where they assess, deliver information, use teach-back and other tools like Show Me to understand what the patient understands, and then kind of continue that process to kind of build up the patient's knowledge, understanding, and confidence prior to discharge. And then the evidence says have a discharge conference and an understanding where they are, and then doing some post-discharge follow-up to make sure they do follow up with their doctor, they do take their medications, and they do the lifestyle changes that they need to do, and that they understand it. So
that's a great summary of what the research says we should be doing.
Okay, cool. Well, we shall publish this episode and hope that we inspire a few more people to carry the flag and see what they can do in their hospitals to improve patient education, and then accomplish the two goals of reducing length of stay and then also taking a bite out of readmissions and reducing those as well. Well, Fran, thanks for your time today. Why don't you tell people how they can find you?
Well, I have a blog at www.notimetoteach, and I'm on Twitter tweeting resources for patient education at No Time to Teach.
Yes. And for those of you interested in Fran's book, you can find it wherever books are sold. It's both in paper and digital form, so you can download it for your Kindle or e-reader. And then if you are interested in using the book for group teaching, you can contact her publisher, Pritchett and Hull, and they will provide you with a sizable discount for a bulk purchase that you could use for group classes and things of that nature. And then for those hospitals that recognize the importance of patient education and want to add video as a tool, if you're interested in learning about video on demand, you can visit our website at synergybroadcast.com and look under Solutions for Patient Education, and you'll find all kinds of information about video and patient education and how to use video on demand to do all the things that Fran talks about doing. So I want to thank everyone for their time and attention. Hope you enjoyed this episode. And Fran, I'll see you next time.
Okay, bye, Chuck.
Bye-bye.